Mary, if you could just sort of leap off of what Will said there and think about education, and is there a role, or what is a role for someone like yourself to help with that healthcare professional education? You know, as Will said, it's not necessarily complex, but it's knowing what to look for, it's knowing where to go for the information. So what's your kind of role in that?
Yeah, exactly. So I just want to say one little thing. Just I totally agree with Will about the technology that we use in the NHS. Listening to Sal, I'm like, this is the ongoing problem that we have, especially being, a national centre, is that we have people coming from literally all over the country, and so many people don't realise that NHS isn't connected. I'm like, I wish it was, but
Yeah.
it's not, and so they'll come and be like, oh, why don't you have my scans? And we're like, we didn't know you had scans. If you don't tell us, we don't know. And so that is the changes that we're using in technology, although they have been driving everyone insane. We changed our computer system a year ago and it was a nightmare. But a year in, starting to see the benefits is that now I can see, anyone who's gone to, say, we're at in a London hospital. There are several London hospitals that I can see all their clinical records now. I can see when they've had their sarcoma MDT discussion. I can see where they've gone and had imaging. Even in Oxford now, I can see if they've had stuff done in Oxford. So when we're talking about the future of the NHS, that is something that gives me a lot of hope, is that as technology has improved, hopefully this joint up NHS working is going to improve. It will get better. I'm going to keep being hopeful about that. But in terms of learning, so you probably know already, Childhood Tumour Trust have an accredited online course on their website for health professionals, so anyone can access that. And I know they're very active, and as are Nerve Tumours UK, at making sure that they get to as many conferences as possible to try and keep raising awareness. Members of my team have continued to go to the British Academy of Childhood Disability. I had to look that down because I can never remember what BACD stands for. Where they're doing teaching on NF1 to paediatricians and physios. We would love, I know someone put in the Q&A about health visitor. If you have an in, we would love to go and teach health visitors. That would be amazing.
Amazing. There's a call to everyone that's listening.
If you know anyone, my pediatric team would love to go and chat to them. Also, our colleagues in America in the Childhood Tumor Foundation, they have a whole range of masterclasses on their website for health professionals. They are I mean, anyone can watch them, but they are in quite technical language. So sometimes I watch them and I'm just like, this is science way over my head. But they're really helpful on all sorts of different issues that NF1 can cause. And then also, as a massive teaching hospital, we have people come and shadow our clinics quite frequently. We're really open. If you know of any health professional who has a vague interest in NF, we love having people come and see what we do, and for us to be able to show different types of manifestations that we see in clinic. Because what I don't want to hear is when people come to me and say, oh yeah, my local team, they said I was really rare and they've never seen anyone like me. And this surgeon, he just said he'd have a go. And I'm just like, no, absolutely not. I'm like, if you are going for surgery, you want someone who is like, oh yeah, I've seen loads of
I've got
these.
it.
I've been doing these for years. Like, if anyone comes near you with a scalpel who says they've never seen NF before, run. Do
Yeah.
not,
But I think
don't
that's
pass
amazing.
go.
What you're doing there is allowing that, people to come and learn and take that expertise back out
Yeah,
into these other, populations where the
absolutely.
patients are. And I think if I'd like to come back to you, Sal, before we go to some questions, because we've got lots of great questions, which is fantastic. Obviously, your children are kind of thinking, they're not that far away from transitioning from pediatric into adulthood. So, what are your hopes or thoughts about what that might look like for them? Obviously, you're kind of seeing it from the adult side. Does it give you
Yeah.
concerns thinking about their transition into that next step?
I think the hope for me is that there is that support system out there for them, and that it doesn't just stop at 18, because that's how I feel it is at the moment. Like, again, unless you're complex, there doesn't seem to be, from my standpoint, any kind of services for adults and the support for them. And I don't know whether I misunderstood this question a little bit, but again, it's about that early diagnosis and that multidisciplinary care. Because for me, you know, once I'd got my head around that diagnosis when I was 42, I felt like the last 42 years of my life actually made sense, because I had a lot of physical limitations, which I didn't understand. I had a lot of cognitive differences to other people, which I've learned to mask and get through life with pretty much, which is absolutely exhausting. And for the first time, I understood why I was the way I was. And I think for the children, I tell them how amazing they are all the time, but I'm adamant that they won't go through what I went through and feel the way I felt. We do talk about NF1. We talk about all the good things that they can do, but when they're getting upset about things that they find difficult because of NF1, we also address that so that they understand why they have those differences. So I think for me, it's just that continuation of care for when they get older, and I'd like to see in place, because the Childhood Tumour Trust has been brilliant. The first meet-up that we went with them after meeting this other family was at a large shopping centre where we met other families with NF1. We made a bear. We didn't feel that year that we could go to the big meet-up because it was still quite raw and we hadn't spoken to many people about it, but we did go last year and we met lots of other families at a theme park with NF1. It's by having access to those services and meeting other people that you actually think everyone's just normal families like us.
And it's empowering you to then have those skills to reach out to those other people and do that role of coordinating as well when you need to.
Yeah. And these charities, again, like the Childhood Tumour Trust, they've done things like early diagnosis workshops with us. And I just hope that the children, the adult services for them, will continue throughout their life to support them, because obviously I didn't know I had NF1, so I didn't have that. So I'm not actually quite sure what is out there for adults.
No, so there's definitely a gap there. And I think, it kind of comes back as well to that starting point, which is that the diagnosis is definitely an area where all of these things that, that are happening need to start feeding back into that and improving that initial diagnosis. I really appreciate you all being so candid. I want to try and get to some of these questions, so I'll just kind of rattle through them and direct them where I think they need to go. So there's one here asking about the increased risk of breast cancer for men in NF1. I think I'm right in saying that there is no real data to suggest that, but what I would suggest to that, I don't know if you wanted to add anything, Mary, but my understanding is that there's no increased risk for men, but certainly reach out to Childhood Tumour Trust. They've got a dedicated page with all of the facts and information around breast cancer. So unless you've got anything to add to that, Mary.
Yeah, so I think totally agree. I'd say for because we get asked this, like, it is to do with the hormones in women, where they think there is that increased risk. But I think for men, women, anyone, it's so important that your body. I really appreciate Copperfield, the work that they do, and their little tagline, "Know you're normal." And I think that's so important for NF is, regardless of whatever gender you are, that what's normal for you, your body. And especially if you are aware that you have any larger lumps anywhere in your body, that you are not obviously checking every day. We don't want to get, too caught up on it. But, monthly, just kind of check yourself, know what's normal, check that all the lumps are still soft and squishy. And obviously contact people if anything is growing rapidly, changing texture, so becoming hard and immobile, or increasing in pain, especially that sharp shooting electrical pain. That's when, regardless of where that is in your body, that you're seeking help.
Amazing. Thank you, Mary. Just some comments here. So someone saying their daughter was recently diagnosed just before Christmas. She was sent for genetic testing. Looks like the pediatrician was very surprised because they'd never heard of it. And they're asking whether NF1 can sit alongside another genetic condition. I mean, I'm guessing like any genetics, there can be more than one thing going on. But Will, is that something you could answer? Perhaps give a response to that?
So yes, I mean, as you say, yes, you can certainly have more than one genetic diagnosis. Occasionally we have families who we make 3, 4 separate genetic diagnoses in. So that's certainly possible. I guess having NF1 doesn't per se make you more likely really to have another genetic diagnosis, except in a few very unique genetic circumstances. So routinely, no, but obviously, yes, genetic conditions are often individually rare, but as we all know, collectively common when you bring them all together. So unfortunately, you can have more than one.
Absolutely. So another one here, just really reinforcing, I think, your experience here, Sal, says it seems very common that diagnosis of NF1 is really challenging. Cafe-au-laits are often dismissed as just birthmarks. GPs constantly dismiss their daughter despite being also monitored by ophthalmology since 3 to 4 months old for what they now know as a plexiform neurofibroma. Also received a formal diagnosis via a phone call, which is hard in itself, as there are a lot of questions. I mean, very similar to your experience there, Sal. Since being referred to NF1 specialists, our experience has been amazing. But what can be done to improve the referral process to paediatricians and diagnosis? This seems to be a weak link. I think we've talked a lot about that. So, but yeah, definitely, I think that's a very clear theme coming out. That diagnosis and that referral pathway needs a lot of work there. Someone here, and maybe this is a question for either Sal or Catherine, has anyone ever experienced bullying in school environment and being singled out because of visually they look different, and have schools been able to deal or intervene appropriately? And any advice? I think that's a really important one, because school can be a tough gig for anybody, let alone when you maybe feel you stand out a little bit. So does anyone want to maybe offer any advice if they've got some experience in that?
We haven't got experience. It's certainly not something that has happened, but it is something that definitely I'm very concerned by. So as I say, Alfred's 9, so in the next year we'll be looking at sort of transitioning into secondary education, which fills me with fear, mainly because it's moving out of, I suppose, the comfort blanket of primary, and he's been with the same group of children since he was in nursery. So they all know him and are very aware of him and understand NF1 and his hospital appointments, etc. But the thought of secondary school and everything that brings is not particularly a pleasant one. So I suppose all I can say is that yes, it is something that concerns me a great deal. We haven't had experience of it, thankfully, even though Alfred has got a very visible difference. What I would say is, I suppose we've always been very open with him, and he's very resilient around his diagnosis. So he knows that he has NF1. He talks about it. He talks about being special and that he has a condition. And I suppose we encourage him, and will continue to encourage him to own it, essentially, and to, be very open and talk about it. How that will go as he gets older and children potentially get meaner, I don't know.
I think good dialogue with the schools is really key
Yeah.
here. It's easy to get upset and be confrontational with schools, but they're trying to navigate it as well. So just, having a good plan in place before they go, having good dialogue. And I would definitely say, if that's a concern for someone, to reach out to Childhood Tumour Trust and to any of the other charities, because it would be helpful to be connected with the parents who have been through it or who have got some advice. Obviously, Sal, you mentioned that you'd had someone in your school before as well. So, speaking to people that have got experience in navigating that would be really helpful. So perhaps maybe we could say just connect with the charity there to get connected really to people.
Definitely. And it is something that I think some of the older children do occasionally talk about when there are the online sessions with the Childhood Tumour Trust. And that the power of that peer support, as you say, the information is on the website to help with people and other charities. We have been on sort of an online workshop previously with, don't mind me mentioning it, but the Changing Faces charity, as they do a very specific workshop around visible difference and sort of bullying and things like that, which we found quite helpful. So, there are things out there, but I mean, obviously, people are people, and it's about, I would suggest, coping mechanisms at the same time.
Yeah, and that empowering the children, which, you know, you're doing all the right things with attending the group. So, we've got one here from somebody from Indonesia, actually, who, really interesting, said that there's no interest really from researchers and the medical personnel there. So what I would say to this person is, Mary has said they're really happy to educate healthcare professionals, and try and enlist some people in Indonesia to connect with the team there at Guy's and see whether there's some education that could be done there, some shadowing to take some information back to the region. I think, you know, that's a key thing there, but frustrating when you feel that you haven't got that. It's great. They said they're really grateful for the webinar and to have this valuable information. So great to be able to connect with Indonesia, and please do reach out to us so that we can connect you with Mary and her team, if you don't mind me saying, Mary.
Absolutely.
We actually had that happen in one of Alfred's appointments at the end of last year at one of his annual checks at a London hospital, not Mary's, and there was a doctor from, I can't actually remember where they were from now. I think it was an African country, and they were there to very specifically observe around NF1 and very much asking lots of questions. So, you know, I think it is happening, but probably in very small number, I would imagine.
Well, that's a really exciting way to end, actually, on that. I think, you know, that prospect of really raising the profile, getting the education out there, and, you know, realizing that actually, you know, we're talking about the challenges here, but I'm sure they're greater amplified in other regions where maybe there isn't the same access to specialties. So we have got quite a few other questions and comments here, but I think just want to be respectful of everyone's time that's joined us. So what we'll do is we will follow up on those questions, and we'll get some responses from the team and feed those back when we send out the links to the live recording. But there is just one more I want to pick up on here before we end, which was someone talking about eating disorders associated with NF1, restricted food. Their son's 12. So again, really just demonstrates that point of multi-systemic, multidisciplinary importance. They talk about renal disease, mild hearing impairment, nonverbal autism. So really shows the variability there. So, but I don't want anyone to feel that we're not getting to those comments. So we will follow up with them by email for those that have taken the time to answer them. But as I say, just want to be respectful of everyone's time. So as we wrap up, I want to give a huge thanks to all of the panelists for joining us. It's been such a great conversation. I've been really looking forward to doing this one. We love working with Childhood Tumour Trust and on the NF1, so it's been great privilege to do that. Please do watch out for the Childhood Tumour Trust campaign that's coming in May. They're going to be doing a lot more work around this 1 degree of separation, so watch out for that, and thank you to them and to Lexion for supporting this. If you haven't, if you know people that would have liked to have joined it, although it's live, we're going to have to catch up, so the links will be shared afterwards. So please forward them on to anyone you think this would be relevant for who missed it today, and we'll have some contacts coming up at the end. So feel free to reach out to us if you want to be connected with any of our panelists. And as I say, we will follow up with all of the questions that we haven't quite got to in time. But thank you all so much. Really appreciate your insights, and thank you to everyone for listening, and have a great rest of your day.